Back now on Triad Today, and I will say that I am prejudiced about this segment because I'm a graduate of UNCG. I'm always interested in what's going on in all the universities around here, and this is fascinating because it has to do with the School of Nursing. And I want you to meet this lovely lady. She's been with us before. I'm glad we were able to get her back. Lori Bates, director, of course, my good friend. Robin Remsburg. Dr. Remsburg is Dean of the School of Nursing at UNCG. Welcome back.
Thank you, Jim.
Good to see you. Last month you graduated your first class in what's called if I get this right, correct me, the Veterans Access Program.
Correct.
Now we're talking about nursing, but this is a Veterans Access Program. What is this all about?
Well, it's a wonderful new program that we started in 2015 for veterans who have medical experience in the military, who have training and have worked as medics or as pharmacy techs or as medical techs.
Oh, okay.
It's an accelerated Bachelor of Science in Nursing program, so it helps them to translate that experience and training into a career in the civilian life.
Because they come back off the field and they've had all this great experience in combat or around the combat zones, but maybe they didn't go to any college before that.
Exactly. So we have a way to assess what the learning that they've had in the past, and then put them in the appropriate courses that they need to achieve their bachelor's degree.
So let me make sure I understand, their experience in the field is going to count toward what they're trying to achieve.
In many cases it does.
Now, there's also something new. I was reading an email from you and Alyssa the other day about a Doctor of Nursing practice.
Yes.
Now, is that a degree? Is it a program? Or what is that all about?
It's a new doctoral degree. It is the highest degree that nurses can achieve as a clinical degree. It builds on our 2-year master's program. It adds an additional year. We've produced for a long time expert clinicians and administrators and executives that work in the health system. But this degree has added value. It adds content in leadership, in safety and quality, in health system operations,
wow,
in all of those areas that clinicians need to know and be facile in to be able to help the patients do the best they can.
Why is this so relevant today?
Well, the health system is very complex. It's fast-paced and changing every single day. And our patients are much more complex than they've ever been. Many of them have multiple conditions at the same time: diabetes, heart disease, asthma.
Have a lot more questions?
A lot more questions, a lot more management to do, and so clinicians need to have more skill and knowledge than they've ever had before to manage these patients effectively.
This is great. Now, last year, as we talked about ad infinitum on this show, voters passed the Connect NC bond, which translates to a lot of the universities and colleges, new buildings and structures and things, improvements. How will the funds impact you?
Well, for UNCG, we receive funds to build a new nursing building. So we have begun actually plans for a new nursing building that we hope will be ready for occupancy in the fall of 2020. It will have new facilities that enable us to simulate real-life clinical and lab experiences for our students. We're currently in 5 different buildings on campus, as you know well.
That's not very productive.
Not very productive. So we'll all be under one roof, all of our students and faculty and staff, and we'll triple the size of our simulation and our classroom
wow,
and learning spaces. We'll have a community engagement center and a small clinic where our students can practice and deliver health promotion and prevention services.
2020, you think?
2020.
Kind of appropriate, because our vision is we wanted to get there anyway, and now we're going to get there.
Yep, exactly.
UNCG School of Nursing has a big anniversary coming up. Tell me about it.
It does. We are so excited. We're planning our 50th anniversary for April. We plan to bring faculty and staff and students and our clinical partners together for 2 days of festivities on campus. They'll be able to tour the campus and see how much it's changed dramatically over the last 50 years. We'll have a gala reception at the Weatherspoon Gallery where we'll connect our history with the Cone Health System and the Cone Sisters and their contributions of artwork.
Now what week or month, tell me again when this is going to start.
April 7th and 8th.
April 7th and 8th, okay.
And we hope a lot of those alums, we have over 8,000 alums out there over the past 50 years. We hope they'll be able to come and join us.
Sure.
And
and people wonder why I was writing this down, because it's not too early to start making plans. People, especially if you're coming out of town or if you happen to see this broadcast on the internet or something. So I hope you'll get a big crowd. Before we run out of time, I want to show the website there, uncg.edu, which has all sorts of information about the university, including the School of Nursing. It won't tell you how great a lady she is, but just by reading her bio, but I can tell you she is, and Robin has done so many great things for the university and the community. Thanks for being here.
Thank you so much.
All right, my friend.
Enjoyed it.
We'll be right back after this.